Hi, everybody. This is Stacy Dim at the Arc of Washington State, and I want to welcome you to our 5th virtual advocacy days to discuss the impact of COVID-19 on our community and the drastic economic challenges that we face ahead. This is part of a 6-week series discussing impending budget challenges with some of our key state legislators. And today I'm very happy to welcome Senator Frockt from the 46th Legislative District and Representative Tana Senn from the 41st Legislative District. As I mentioned, I'm Stacy Dim, the Executive Director of the ARC of Washington State, and I'm co-hosting this event today with the Washington State Developmental Disabilities Council and with Self Advocates in Leadership, or SAIL. We appreciate that you're all here with us today, and we want to remind everyone to be respectful of each other's feelings, of our backgrounds, of differences in our language and our ability to communicate. And please just look at different perspectives today. We should always assume good intentions of our fellow Zoomers and our fellow legislators. And remember, it takes great courage to share our stories and to speak up. So let's be sure to support each other today while we're together. I'm very excited about this opportunity today. And now I'd like to turn things over to Jessica Renner from SAIL to share some tips for interacting on this platform on Zoom. Take it away, Jessica.
Good morning, everyone. My name is Jessica Renner and I live in the 33rd Legislative District. I am an advocate as well as the Advocacy Coordinator for Self Advocates in Leadership SAIL. I will be yourself advocate co-host alongside the ARC of Washington State and the Washington State Developmental Disabilities Council for this virtual Advocacy Day 6-week series. There are a few things you need to know before we get started. First, everyone will be muted at the beginning of the webinar. Second, I would like to remind everyone that we are also live streaming these virtual advocacy days on our Facebook page at www.facebook.com/thearcofwashingtonstate. Third, we are also recording each week's presentation and will post the recorded sessions on our website at www.arcwa.org. Fourth, if any of the participants today want to welcome the guests or talk to other attendees, please use the chat box. If you have questions, you can type them in the Q&A box or raise your hand using the icon. Click on the raise hand icon to ask a question, or to post a question. Type it in the Q&A box by clicking the Q&A icon located next to the chat icon in the middle of your toolbar. If you raise your hand, we will unmute you when we call your name. Then you can unmute yourself using the microphone icon on the bottom left side of your toolbar. This will allow you to ask your question. The raise hand icon is located on the bottom right corner under the More option. Please note as a reminder, please hold your questions until later in the program, when we will answer questions posted in the Q&A. If you need clarification on something, post it in the chat box and someone will try to address it. Finally, I want to ask where people are from. Please type what county you are from in the chat box with that. I'll turn it back over to Stacy to continue on with our program.
Thanks, Jessica. Again, I'm really excited about this opportunity today, and I just want to take a moment to share information about the 3 organizations that are hosting the event together. I'll get started. The ARC is a national organization that promotes and protects the human and civil rights of people with intellectual and developmental disabilities, ensuring their full and active participation in all aspects of community. We do have 8 local county-based chapters across the state, and we've been around since 1936. The ARC is known for pioneering progressive governmental policies that promote independence and self-sufficiency and inclusion, and for innovative programs and services and informing and educating society about the enduring potential and inherent value of people with intellectual and developmental disabilities. And I'm a proud part of that organization. I'm also a sibling. So I'd like to introduce Jeremy Norton Paul. He's the Executive Director of the Washington State Developmental Disabilities Council. Let him say a few words. Jeremy?
Thank you, Stacy. My name is Jeremy Norton Paul, and I am the Executive Director of the Washington State Developmental Disability Council. I'm very excited to be here supporting this event alongside Self-Advocates in Leadership and the ARC of Washington State. Just very, very briefly about the council, for those of you who may not know, the Developmental Disabilities Council is federally funded, and we've been around in Washington since 1976. There is one of us in every single state and territory across the country, which means there are 56 of us total. I think that we're the best one, but a little biased, of course. And we do a lot of things, but basically our job is to advocate for the more than 100,000 people with developmental disabilities and their families across the state. And simply put, our mission is to help make sure that people are able to live meaningful, integrated, and productive lives. And to the extent that we need to change policies or systems or advocate for things to be different, that's what we do. And one of the most unique things about our council is that our members are appointed by the governor, which carries a special significance when it comes to implementing strategies and making decisions to help make the system better for our state. So now I'm going to hand it over to another team member on the council, Emily Rogers, to introduce herself.
Okay. Oops. Oh, dang it. Hello, my name's Emily Rogers. I too am with the DD Council, and I do several things with the council, do contract related things, but then I do advocacy related things when I have the opportunity. So I'm really glad to be here.
Great, thank you, Emily. And Jessica, you want to go ahead and describe SAIL?
Self-Advocates in Leadership SAIL is a statewide coalition in Washington state of people with developmental disabilities. The SAIL coalition strives with legislative advocacy to shape public policies that affect the lives of people with developmental disabilities. SAIL meets the second Tuesday of the month on Zoom from 1 to 4. SAIL, along with the ARC of Washington and the DDC, hosts advocacy days each year. SAIL puts together their own legislative priorities and one-pagers each year on the issues that SAIL members think are the most important to share with legislators during the legislative session.
Great, thank you, Jessica. And now I'm going to turn it over to Diana Stadden with the ARC of Washington State and let her introduce herself and the legislators we have here today.
Good morning, everybody. And we have a wonderful day here planned. We're very fortunate to have Senator David Fraught. He's from the 46th District, and Representative Senn from the 41st District today. So, Senator Fraught, would you like to introduce yourself today?
Good morning. Thank you for having me. I'm flattered by to be asked to be here. And I always learn so much from my work with the ARC, both in the annual King County Forum we have in November, but also through meetings and hearings that we have during the legislative session. I appreciate you putting the picture of me in a suit and tie up on your screen there. I have not worn one of those since March, since we've all been homebound. So it reminds me of a time I hope we'll get back to when we have to dress a little more formally to do our work. But at least informally, I'm very happy to be here. Diana, did you want me to say a word or two sort of substantively, or just to introduce myself?
Just introduce yourself.
Okay,
right
well,
now.
I'm David Frockt. I'm from the 46th District, which is North Seattle, and I serve on the Healthcare Committee and the Ways and Means Committee. Thank you.
And Representative Senn, would you like to introduce yourself?
Yeah, hi everybody. Tana Senn from I live on Mercer Island, and I represent East King County, as it shows on the screen, covering 6 cities and Beaux-Arts Village. So Mercer Island, Bellevue, Sammamish, Issaquah, Renton, Newcastle. And I am chair of the Human Services and Early Learning Committee, which DD issues go through. And I'm on the Appropriations Committee, which is the committee that funds those issues. And I serve on local government as well. I'm thrilled to be here. And as my good colleague, Senator Frockt said, I haven't worn earrings in a really long time. And I'm like, oh, I don't really look like my picture anymore. So we all know what Zoom and the pandemic is doing to us, but it's great to be here. And this is one of my favorite advocacy groups and cohorts of folks. So looking forward to our conversation today. Thanks for having me.
Thank you both for sharing a little bit there. We want to find out where everybody else is from and what position they may be here today as. So we're going to pull up a little poll. And if everybody could cast a vote, I guess, here. We have a lot of self-advocates who join us, a lot of family members, sometimes providers of DD services, and of course our policymakers we have here with us too. So we'll just take a minute and let everybody have a chance to cast their vote in the poll and see where everybody is from. It looks so far like we have a lot of family members here today, and then a number of service providers as well. Self-advocates we usually don't have as much because not all self-advocates have access to Zoom and these kind of things now that we're in this, just something we really want to increase for them. So it looks like everybody has put in their number on the poll, and we do have a majority of family members here today. So we are going to go a little bit into some information for background for both the legislators and their constituents who will be speaking. And so we're going to start with Jeremy. He's going to introduce us to some of these services that we are going to be talking about.
Thank you, Diana. Could you go ahead and go to the next slide? Thank you, Diana. So there's a lot of information on this slide, and I'm not going to read it all or go into a whole lot of detail, but I wanted to point out a few things. Oftentimes when we're talking about services and supports for people with developmental disabilities and their families, a lot of us tend to think that they only come from the Developmental Disabilities Administration. And it is absolutely true that the Developmental Disabilities Administration, or DDA, is an incredibly important agency in terms of providing supports and services for people, but it is certainly not the only place that provides support and services to people. And in fact, only about 1/3 of the folks who have developmental disabilities in Washington receive supports or services from DDA. And so on this slide, there are two main messages that I would call to your attention. One is that any potential cut to developmental disability services in state agencies would cut very wide. And number two, they would cut very deep. And I'll tell you what I mean by those two things. If you look at this chart, you can see that people with developmental disabilities and their families are supported by many different state agencies, all the way from the Department of Social and Health Services, which includes both DDA and the Aging and Long-Term Support Administration and the Division of Vocational Rehabilitation, all the way to the Department of Children, Youth, and Families, Office of Superintendent of Public Instruction, Healthcare Authority, Department of Health, all the way across the board. The dotted boxes mean that that program is something that is not specifically only for people with developmental disabilities, but people with DD certainly benefit from that program. And the boxes with a solid line around them mean that that program is specifically for people with DD and their families. But what you can see here is that any cuts to state agencies across the board would have very wide impact and very wide harm all the way across the board. My second statement that cuts would be deep, if you look here at the bottom of this slide, one thing you'll see is information about what's called a federal match. And that means that for a lot of the really important services that people receive through DDA, the state of Washington invests about half of the money that is needed for that support, but the other half is matched or comes from the federal government. And so it's a 50-50 split, which means that any cut to those services is basically a double cut, which is why I said that cuts would also be deep. And so if you take nothing away from this slide except for two ideas, it would be number one, that cuts across the board to state agencies would be wide and affect people in all sorts of different ways, and they would be deep. People would be feeling the impact doubly as much because of the federal match. And so with that, I will hand it back over to Diana to introduce our legislator, to Stacy. I got a little out of order there. I'll hand it back over to Stacy.
Thank you, Jeremy. I appreciate it. Diana, you want to do the next slide? Diana?
Yeah.
Next slide. Thank you. So this is our Dda Biennial Budget with about, as you can see, $1.8 billion in general state funds and a matching federal amount of about $1.8 billion. And as Jeremy mentioned, that's important because the cuts that are proposed in developmental disabilities would be a double cut because we would lose federal funds for some of those services. Out of an estimate of about 120,000 people with developmental disabilities in our state, you can see there are almost 50,000 people enrolled with the Developmental Disabilities Administration. But of that 150,000, only about 35,000 receive at least one paid service from DDA. We also have almost 14,000 people on a no paid services caseload. So those are people who are eligible for services, they've asked for help from DDA, and they wait for services. We can see that just from this, we're only serving about a third of the people that we would expect to see sort of in our DDA system. And it's important to note that our DDA does not provide any housing or any crisis emergency services in our state. The graph on the left shows the dollar amounts and the percentages spent on each program provided by DDA. And as you can see, most of the funds are spent on community residential services. So that includes services like supported living, group homes, and other residential services and in-home supports. And then about 37% are supported with in-home services. So they're supported by their families, but they get other services such as respite and other important supported employment services. About 13% of the budget, as you can see, is spent on RHCs or our state institutions. And we have about 551 long-term residents in our RHCs at this point. We know there are about 67 individuals who are ready to leave, but they have no community placement available to them. Just a quick note, we also have about 7 people currently stuck in hospitals and about 53 DDA eligible clients who are stuck in psychiatric facilities. And we know that's been a long-standing issue. There are also, just to take note, about 256 DDA eligible clients who are in nursing home facilities that are separate from the RHCs. So that just gives you a little bit of a snapshot of where services are going right now. I'll turn it over to Jessica to continue to, oh, I'm sorry. Diane, if you could do the next slide. Actually, I'm the next slide, introducing some of the DDA proposed cuts. I'm sorry about that. So some of the proposed cuts in our Developmental Disabilities Administration come from the exercise that OFM, the Governor's Office, asked the state agencies to go through This is a 15% across the board cut. And these have not happened, but they are certainly being proposed. Most importantly would be to reduce the number of clients that we're serving by changing eligibility. We know that that means some pretty drastic cuts to home and community-based services that are on our waivers. It would not allow new placements. And because the majority of what DDA provides are residential services, we know that that means it will severely affect people who are currently getting services and some who will receive residential services. We know that the cuts involve reducing respite hours for eligible clients, which is a vital service for our families. The majority of our individuals are supported by their families, and respite is a key service to allow them to stay successfully in their homes. There would be no new children's enhanced respite beds and no crisis stabilization for children. And the cuts also involve 1.8% cut to the supported living rate that was approved during the 2020 session. There are also rate cuts in adult family homes that are being proposed, which serve a great number of our individuals with developmental disabilities. There are rate cuts to staff that transition clients from hospitals, and a 5% rate reduction for individuals in individual and group supported employment. Okay, now the next slide. And Jessica, if you could talk a little bit more about some of these cuts.
Rehabilitation centers are scheduled to take some cuts too. Self-advocates are happy to see that Rainier will close and that consolidation of cottages will happen at Fircrest, Lakeland Village, and Yakima. But the state will keep state-operated living alternatives to move the RHC residents into. There are also services for people with IDD under other agencies, adding more to the 15% cut in DDA. The Health Care Authority is where some of the Medicaid optional services are scheduled to be cut, such as physicals, dental, therapies, interpreter services, and the dentist link for Medicaid patients. Additionally, Aging and Long-Term Services Administration will have eligibility changes and will eliminate adult day health and adult day care, as well as eliminating meaningful day programs and residential programs. The Department of Health will make cuts to neurodevelopmental centers for birth to 3 providers.
Thank you, Jessica. We are now going to introduce some constituents from the 46th and 41st District. And so first we are going to have Allison Burchett, and she's a constituent of Senator Frockt, and she would like to share a little bit about if these proposed cuts happen, how that would affect her and her family. Allison?
Thank you, Diana. Hello, as Diana stated, my name is Allison Burchett, and I live in the 46th Legislative District, and I am your constituent, Senator Frockt. I want to thank you and Representative Senn for being a part of the discussion today. My family currently benefits from the DDA's IFS waiver, primarily providing us with respite care for my 10-year-old son who has Down syndrome. More than ever before, respite is needed for families like mine who are overwhelmed during this ongoing period of crisis. For any family, the combination of working from home, educating kids at home, and disrupting routines is a challenge. But for families like mine that include individuals who absolutely need those routines to thrive and manage even normal stressors, the present situation can be dire. This summer, every nonprofit camp, which is designed to provide respite for families while also providing positive care and opportunities for individuals like my son, every one of those was canceled. This, of course, was on the heels of more than 3 months of being at home because schools were closed. While all families are dealing with the financial, emotional, and physical stresses of the current climate, Families like mine, who on top of all this care 24/7 for individuals with a higher level of need, are at the breaking point. And now, when we are tapped out, budget cuts are being suggested that would take away this one remaining avenue for respite. Respite is defined as a short period of rest or relief from something difficult. Sometimes I feel like respite is viewed as a luxury rather than a want, or a want rather than a need. I suggest that respite is essential for the families and caregivers to continue to maintain a loving, nurturing relationship and living space over a lifetime. Individuals with developmental disabilities are at a higher risk of abuse and neglect when we're not experiencing a pandemic. Within a pandemic and continued confinement and social distancing measures and the higher levels of stress in themselves and their caregivers, these individuals are at an even higher risk of being abused. In fact, many of the added stressors that we are all feeling as a result of the pandemic are stressors that were already in place for families of individuals with developmental disabilities. Things like fears for health or concerns for our financial future. And now those fears and concerns and stresses are heightened. You're both parents, Senator Frockt and Representative Senn, I believe. So an example, think about how much more difficult it is when you're sleep deprived to be patient with a child. Individuals with developmental disabilities have a higher prevalence of sleep issues, resulting in sleep deprivation for both themselves and their caregivers. I can count on my hands the number of nights my child has slept through the night in his 10 years of life. Respite care is absolutely crucial for me to be able to cope with the effects of my disturbed sleep every night. I believe both Senator Frockt and Representative Senn that you were both present last November at the Legislative Forum, where we all viewed a video of a very courageous woman, a mother, sharing her story about the difficulty of caring for her child without any respite. I'll never forget her. She was completely drained. She clearly didn't get sleep. She obviously needed a break. I don't even think she had the ability to form a smile on her face. I still think about her, obviously. She was in a state that all of us will be in if DDA funding is cut, and that is scary. Families will be in crisis, and then it will be an even bigger cost burden for our communities. The IF's waiver is just that. It's a waiver. By accepting it, I waive my rights to having my child institutionalized at a tax burden of $250,000 per year in exchange for a benefit that costs less than 1% of that amount. And yet that tiny amount does provide something absolutely beneficial to the health and well-being of my family, who of course all want to care for my son in our home anyway. Please, please ensure that this doesn't get taken away by budget cuts. Thank you.
Thank you, Allison. That was very informative and moving. At this point, we have a self-advocate who really wanted to speak today, but she is actually working. And so she made a video, and we are going to show that shares all of her concerns. And if we can make sure that all of the panelists have their video off, that would be great. Okay, everybody, we had a little bit of technical difficulties there, but we are going to have that fixed in the video. We'll have it closed captioned, as well as we will work on getting that the audio to be working as well. So now we're going to move on to the 41st district, and we have Joanne O'Neill, and she has her son Brendan with her, and he has a wonderful smile. And she's going to share a little bit how these cuts would affect them. Joanne?
Thanks, Diana. And yes, I am a constituent of Representative Senn, and we all have met her many times and are grateful to her. Brendan is 40-something, 47 years old. He has lived with us his entire life and continues to do so. He has, I guess the shortest way of describing him is a gentleman with cerebral palsy, and he has limited mobility. When he gets out and has his power wheelchair, he takes off, and he's really great. His care and assistance from his family is pretty a lot. Physically, we have to help him with his daily needs, as the dressing and shaving, brushing his teeth, all of those things that make it so we can get out of the house and go to work. And Brendan has been working since he was 22 years old, and 47 years later continues to work at Valley Medical Hospital. He is home and has been since March because of COVID, because he is in a high risk group. And you would kind of think that a hospital is safe, but there is more risk there for someone like Brendan. So we have him full-time. He has us full-time too. The cuts that would be made in regard to the personal care issues would be really pretty devastating for us. If there's any changes in eligibility, I know that both he and my daughter Megan, who receives services, could lose all of their services. We do not yet have any respite hours, only because of finding a provider that we're willing to have come and they're willing to come. The community is so important. Brendan really is well received at work when he is there. He's a valued employee. He has been someone who has received Employee of the Month. He also has a big poster in his room from when he was the Seahawks cheerleader, more or less, that he was the biggest supporter of the Seahawks for that month. And his job coach and his boss were also in the picture with him. So because I also help other families who have sons and daughters with disabilities, the cuts that would come to developmental disabilities are just devastating. Respite, personal care, employment, stabilization, community residential, all of those things are really important. My husband and I are aging, and I don't mind telling my age that in September, it's not next month yet, I will be turning 75, and I will out my husband saying that he will be 89 next month. Oh, sorry, 79. He's in the kitchen with Megan, so he's going, no. So we are concerned that we are aging, and we have all of our little aging issues, creaky knees, and all sorts of things that concern us, in particular for Brendan, because we have to do lifting and dressing and helping him physically so much. We also hope to maintain our own mental status so that we can care for ourselves as well as our son. So I will just end it at this point and wait for specific questions. But I just am terribly concerned about the cuts in developmental disabilities, and because so many, as Jeremy said, so many of our services have partial federal funding, that it really is a kind of a deadly double cut. So that's all I have there.
Thank you, Joanne, and thank you, Brendan, for giving us that great smile of yours. And now we are going to turn it over to your sister, Megan. And Megan, would you like to share how these cuts would affect you if they were to happen?
Well, my name is Megan. I live in an apartment, but I get help from my parents, and also from, what is it? Caseworker, helping with, I forget to do things like taking my pills, helping with self-care, keeping my apartment clean, and I have a job. But if I don't have my my job coach, I could lose my job.
You're on furlough now.
And I'm furloughed right now because of COVID, because I'm at a higher risk right now because of medications.
And let's see. And I think Megan also obviously is worried about eligibility issues. And in terms of all the other supports that she tends to get, she has a wonderful job coach. She has Section 8 housing, but she's staying with us at the moment because of the COVID situation, and she'd be pretty isolated with the limited transportation. So, but I won't repeat what my wife said. It's just that any significant cuts in her eligibility status would have a cascading effect in terms of reducing other services for Megan, and we're really quite concerned about that.
And also because of 2 years ago, I had
3
years ago, I had a stroke, which made it harder for me to do certain things, like if I have to get into the shower, I have to use guardrails. I have to use a chair, a handhold, so that I don't slip and slide.
So,
and also, I still I'm not on a walker anymore, but I am still on a cane because I don't do well with slippery surfaces or wet surfaces or uneven surfaces. And yes, and I have issues with finding the words that I'm trying to say.
Megan also needs a lot of support with any kind of financial issues, because a good part of her disability has to do with numbering. That's something she had before her stroke, but it's gotten worse since the stroke. So she really has very minimal arithmetic skills, and that includes writing checks, managing her budget, so forth.
Wanting to buy stuff all the time.
Yeah, right. Great, thank you. Thank you we appreciate to Representative Senn and Senator Frockt for listening and being kind enough to participate in this. Thanks.
Well, thank you, Megan, for sharing your story. And obviously you don't want to lose those services either. So right now we're going to move to our legislators and give them a few moments to talk about to their constituents their concerns and hopefully some ideas of what they could do in the legislature so that these cuts didn't happen to people. So let's start with Senator Fraught. If you'd unmute yourself.
All right. Thank you very much, Diana. Well, first of all, I would like to just thank the guests that we had. Allison, I really appreciated your heartfelt remarks, and Devin I've known and met on many occasions, and is just a remarkable young woman. I was not able to get her audio, but I was able to follow the slide deck, and I think I got the gist of what she was saying. And she's just a remarkable young woman, and is just such a great advocate. But I'd say, Allison, in particular, I wanted to respond to you. I was thinking as you were speaking that we have had a lot of discussion nationally and locally about the effects that the pandemic is having, if and when schools are open and so forth. We have not had as much coverage in the discourse about families like yours. And candidly, I mean, I'm so glad that I was able to come today so that I could hear what you had to say and kind of rethink this issue with the lens that you're putting on it, because I don't think that this story is being told. It's hard for all families. It's especially hard for people in your situation that are essentially 24/7 with special needs children. And I think that it's a story that we need to get out there, and we need to tell better. I was prepared to talk a little bit about the budgeting, the small, but I think it was important, the rate increase we had for service providers last year, and some other things we've done. But all of those things, while they have not been cut, they have been proposed as potential cuts. And I think if you think about the dollars that we're talking about in the DD budget, of a budget of about $1.8 billion, 15% would be $270 million in cuts. And right now, the legislature is not likely to come back in before November, and possibly even not even until January. And the reason for that, the reason that there was some consternation about coming in and just immediately slashing the budget, was because we didn't know exactly, number one, how long this might go on. This was sort of going back to what we were looking at in the spring. But then secondly, what the federal assistance might be. And you could see just now with the debate going on in Congress that additional aid that may be coming, it could be several $billion to particular states like ours, could make a major difference in the overall budget posture that we find ourselves in whenever we do come back into session. And so that is the reason for the delay. And I can tell you that I serve as the vice chair of the budget committee. I'm not in charge of the budget committee, but I work with our leadership and I work with our chair pretty closely. And one of my main concerns was that we have not made, we don't want to go back on the progress in some instances, while not maybe as much as everyone would like, some of the progress that we have made in certain areas. And I was thinking in particular of behavioral health and DD services. And I think, as was pointed out in the dialogue from, I think it was Teresa, that Washington doesn't rank very high in our support of DD services, as much as we like to think of ourselves as a state that provides care for people the way that we should. So we need to do better, and we need to try to increase those rates for our care providers, those who are providing services to our clients who are in need, and to make sure that we don't have to make changes to respite care. We don't have enough respite care as it is. And so I think we recognize that that's at risk. So I wanted to wait and make sure that we had a full picture of the federal aid that might come in. And then when we come back in, we're going to have to look at a not going to a solution that we had 10 years ago in the last recession, which was all cuts all the time. And the reason, a lot of people are not talking about, the reason that we had all cuts all the time back then was because we had an initiative that had been in place that said any tax increase would be require a 2/3 vote. 2/3 vote. And I would say early in my career, one of the things I'm probably most proud of that I never taught, it doesn't come up anymore, but it was at the time a really big deal, is we set up a case in the courts to test whether or not it was constitutional. We knew that was not constitutional, but we've never been able to set up a case to have a ruling on it. And I was one of the leads on that, and we were able to have that case adjudicated. And what that means is that when we come back in this next recession budget that we're going to have to deal with, we will have more flexibility to come up with what I hope are balanced and rational solutions that are not all cuts to DD services or any of the other parts of our safety net. We are a very wealthy state and a very wealthy country, and we must find ways to provide for all of our citizens and provide for those who need the help. We obviously know what we need to do better based on our rankings, and by communicating as we are today, I really appreciate the fact this will highlight things that I can take back to my caucus and talk to them about as I just got off a call with them, and we were talking about this very issue about how we're going to deal with our budget crisis. And so these are concrete examples. I'll stop rambling there, and I do want to mention, just as I turn it over to Tana, I'm so thrilled to work with Tana. She and I have known each other actually since before we were both politicians. Actually, a lot of us actually had lives before we were politicians. And so we've known each other for a long time through family and friends. But I moved to Seattle, and she is just an outstanding chair of the Human Services Committee in the House, and is just a real incredible advocate for those who need help in our society. So with that, I'm thrilled to be here with her, and you've got a great friend on the House side for sure in Tana.
Thank you, David. Thank you, everybody. I'll just start with the follow-up to David's ending there. As we often joke, he called and asked me whether I thought he should run for public office when he first ran, and I told him no. So, well, I'm great. I'm glad he does not always listen to me, because thank goodness he did, and then showed me that it wasn't quite as bad as it all seems. But I also want to express my gratefulness for going second after David, because I can't believe that I got emotional on a Zoom call. When we do these in-person legislative advocacy days, absolutely, I always get emotional, but man, just listening to the O'Neills again, I just, your stories so viscerally bring back memories of when my teenage children were little, and how exhausted I was, and how, so happy I am when they go to sleep sometimes still, maybe because they're teenagers. But also knowing and thinking about how I can leave the house whenever I want. I know I get physically tired just cooking and cleaning, let alone having to physically care for my children. So just thank you for putting that human face and the human experience again on these issues. And again, it just really kind of viscerally just brings these back. And thinking about even having something like respite services on a chopping block, which just provides, I mean, a service, sure, but it provides sanity. I can't imagine. But I would say that that the cuts that were proposed were just proposals. There's no actual plan to implement those cuts. And as David said, we are looking at what we will have to do, or we're hoping that there won't be as much to have to do if the federal government comes through. But we certainly are talking about a lot of options. And I think that a key option is increased revenue. because we are regardless going to have a very long-term budget scenario that is not favorable to human services, which are among the like 25% of our entire budget that's even eligible to have cuts. You know, my committee, Human Services and Early Learning, that's basically probably 75% of the 25% that is eligible to be cut falls into that. So I know that this is going to be painful across the board. And the reason why, just to make sure that people understand, like K-12 can't be cut, Department of Corrections can't be cut for obvious reasons, because we still have people in prison, and so those facilities have to be operated. So there's a whole variety of things that can't be cut, and so then the budget strain affects the areas that can be cut specifically. But the beauty of this area is that it's very bipartisan. It is, everybody can really relate directly to families and to individuals with disabilities, and so I think it provides a lot of support, and there's not a lot of interest in cutting in this area by any means, because there's always interest in expanding services, but there's going to be a reality of what comes before us and what we will have to do. Again, I join with David in being a huge advocate for DD services, bringing these issues back to my caucus. I do a lot of work on childcare, and there's actually that really ironic intersection between, needing to support families who are really struggling when their kids are little, or when their kids need extra services, whether it's trauma or they're in foster care and they need the children to have some stability in childcare. And there's a lot of similarities between families needing that respite and children, even adult children, obviously needing respite and other services. I'll just want to close too with the, in your data slide, I don't think there was the number, but somebody was sharing the other day that there are 25,000, was it 25,000, 250,000? There was an unbelievable amount, and obviously those are tenfold different, but that's still just an incredible amount, even if it's a smaller number, of adult children living with their families and across Washington state, and so many of who don't get any services. And as we think about it, and as we think of the O'Neills, again, God bless you, in another 25 years, we are going to have a lot of people who are no longer living at home because that home is not, doesn't exist, and those built-in caregivers don't exist any longer. And we have to plan for that, and we have to think about that. And I don't know if that's always on people's radar as well. So we are lucky as a state to have such amazing parents who are so loving and giving care to their adult children. And I wish the legislature would be able to extend our arms and to be that family as well, even if it's not now, certainly planning for the future. So thank you as always for this emotional and meaningful event.
Thank you, Representative Senn and Senator Frockt. You both are so eloquent in pulling out some of the more compelling pieces of the people that you've heard. And I do want to take just a second and say thank you to Allison, to Dan and Joanne and Megan and Brendan O'Neill, and to Sue and Devin Edelman. It takes a lot of bravery to share your personal story on Zoom and Facebook and in front of a whole lot of strangers and with really important people like your legislators. So I just want to recognize that for a minute and really thank them again. I do also want to take a brief moment to remind everybody that we are in the midst, we're knee deep in a pandemic, and we are tired in many ways in our community. Many people have experienced COVID themselves. They've lost loved ones to the virus, and they're grieving. We have, in our state, you're 4 times more likely to be infected by the virus if you have a developmental disability, and you're 3 times more likely to die from COVID if you have a developmental disability. Many people with IDD have underlying conditions, and we also have over 5,000 people living in group settings where they receive care, and because there are so many caregivers who work across settings, in nursing homes, in other residential programs, working more than one job, the risk is even higher. What we've learned is that during COVID-19, it's become very clear that the ability to receive services and care at home and in the community is critical to keeping people safe and healthy. But there are unfortunately multiple barriers to receiving a home and community-based waiver in our state. So I just want to make sure that we make that note. Given that, we think, in some ways, how could it be any worse? And then here we are talking about the most historical drastic cuts to developmental disabilities programs and services that are a lifeline for care, for medical care, for crisis care, respite care, and frankly, just for living in the community. So I want to recognize that as public servants, I know you're going to be making some extremely difficult and courageous decisions in the near future. And this may be one of the most challenging times to be a legislator. We appreciate you for that. But we also recognize that you're both on budget committees. We really think that the state budget is the most important piece of legislation that passes. It's where we decide where we're going to invest in our people in Washington State, who we're going to protect, and that talk is cheap. Really, it comes down to what is in the budget and who are we going to provide services to. It shows where our values lie. So we hope that you'll help us address in your work some of the underlying inequities that existed even before COVID-19. As I think has been brought up a couple of times, we were 41st in the nation in developmental disability spending before COVID. We have one of the longest waiting lists in all social services across any program in our state. And that's been going on for multiple years, not just recently. With these cuts that we face, that waiting list is going to increase, and the level of crisis that our community is experiencing is only going to increase. So we're facing what I understand is about an $8.8 billion shortfall. We have about $3.5 billion, it sounds like, in our rainy day funds. The cuts to DDA are in the range at 15% of $140 million. And Senator Frockt, you noted that that adds up to almost $280 million in cuts if you count the federal loss of dollars if we cut state money. Our feeling is we probably can't cut our way out of this crisis. And if there was ever a time that the word special should work on our benefit, that it should be now. Representative Senn, you brought up that, there are some things that are protected. They're protected by the Constitution. They're protected by a lawsuit that's happened. And I know that I've spoken with you both about the constitutional protections that are mentioned in the Constitution for our state as well. We haven't had a lawsuit to clarify some of those things yet. What we do think we know is that the Constitution doesn't protect building and lands. It protects people with developmental disabilities. Our thought is there are a number of ways to approach this. Perhaps you could protect us through the rainy day fund alone. Our cuts seem small compared to that larger number. There are ways to designate revenue. There are ways to look at changing the outcome that we might have for people with developmental disabilities. And I'm just curious if both of you could talk about your thoughts in that regard. Just tell us a little bit about what you're thinking and what some of the options might be. Senator Fraught, if we could start with you, that would be great.
Well, I'm not formally inviting a lawsuit, but I would say that sometimes the courts and the rule and the process of ensuring that legal rights are protected, sometimes it requires drastic action. And as I said, before, that part of the reason I think we have a little more flexibility, we have a lot more flexibility now than we had in 2011 is that we don't have what was an unconstitutional restriction in place, even with majorities in the Senate and House that are, on the Democratic side, even with strong majorities, maybe 28 or 29 or 30 votes in the Senate. That would not be enough if we had had a 2/3 for any revenue increase in place. And I think that we need to approach this in a manner that is we have a lot of things pulling at our society right now. A lot of discussion about inequality and the economic inequality that we're facing, about how we need to make sure that our Black and Indigenous people and people of color, those communities are brought into and have the full range of opportunities. We don't have a budget that is, in my view, spending money frivolously as it is. We need to find ways to expand the pie. We need to grow the economy so that the budget recovers, and that is the most important thing, is to get the economy back on track, because that will lead to more tax revenue and more opportunity to provide services. But I think we need to think about all of these things, and I think certainly the disability community, as has been noted, we made some progress. It's not been as much as we probably need to have made, but we certainly can't go back. And I think we should continue to try to push and ask that those who have the most in our society to contribute to the extent to contribute more, and find a way to do that in a balanced way that allows us to maintain the services that the government provides, and that will not inhibit our ability to grow the economy. And I don't think those things are mutually exclusive at all. So that's kind of my general view. I would say that there's a lot of things under discussion. I don't know that I've got that our group has the specifics laid out on what we're going to propose. I think those are still being considered, but I would say the general tenor of our political body in the state Senate is that an all cuts approach is not going to be a one that will work for us this time around.
Thank you, Dr. Thank you. Representative Senn, do you want to?
So it's always great to hear what the Senate's working on too, and getting a little insight. So I appreciate being on here with Senator Frockt, who is such a leader on the budget in the Senate too. So you've got, this is a great forum, and probably making more impacts here than with many other conversations, getting the Vice Chair of Senate Ways and Means on your side. So well done. I think it's very interesting on the lawsuit question, because Washington State really is, we fund emergencies and lawsuits. That's just the nature of our budget, because we have such limited funds, and it's really frustrating. We're also at a situation though, because of McCleary, we were able to add a lot of money to the budget, but then we also have that money now protected because of a lawsuit, and so that can't be touched. So there's that like push and pull. And I think that all comes back down to our revenue system in Washington State. And last year I had legislation to create a capital gains tax, and which would obviously tax people with the highest wealth and capital gains. And the thing that's a little bit frightening about that is that, frankly, I had that money in my proposal to designate purely for childcare. And we were still very limited, because it would really only bring in between $500 million and $1 billion a year, which, or about $800,000 a year, which sounds like a lot of money, but that was like a drop in the bucket. And so, even when we think about revenue and we think about passing a capital gains tax, which again, I personally think we must do and must be just part of the plan, period. That's not even good. That's not going to be a silver bullet. That's not going to save us from our budget crisis. We have a systemic issue with revenue overall. And we are looking at about what's the forecast, David, of $10 billion, $8 or $9 billion outlook over the next 4 years of areas that we need to cut. So even when we use the rainy day fund and we use money that we anticipate that we would have, we're still looking in this next year of $1.5 billion that we need to cut from the budget. So, we're not even talking about using the keeping the rainy day fund. We're not, we're pulling out all the stops to not have as many painful cuts as we anticipate. So we desperately need that federal money to come in. But even if that's just for this year, or for, I don't know if in the next couple of years that money is going to come in, additional money from the feds are going to come in, and this is going to be a long-term issue, a long-term recovery. So, I appreciated Stacy's comments of we have some challenging times ahead, and this, as all my colleagues who were here during the recession, I was not, expressed that was the most horrible time of their careers, because voting to make cuts are painful, and I don't look forward to that. And so I hope that we can raise as much revenue as possible to avoid that, and to get money from the feds to avoid that. And I think that the other side that, there's a lot of comments in the chat and that around diversity. And I think what's, amazing, that intersection that somebody was mentioning early on, of the intersection between race and disability is huge. The intersection between single parents and disabilities is huge. Of age, our Silver Tsunami and DD services, all of that are just, pylons to the situations that families are dealing with right now. So I hope that we can have really honest and valid intersectional conversations in our caucuses, whether it's about the budget or just understanding, disability and ableism, and keeping that in the back of our minds too when we're talking about equity issues and how we make sure that we don't cut inequitably across our budgets. So again, thank you for this forum, and amazing to serve with a compassionate and bright leader like Senator Frockt.
Thank you, Representative Senn and Senator Fraught, for addressing that question. And in particular, thank you for addressing the issue of revenue. That's a comment and question that we not only hear all the time, but as you can see, has come up several times in the chat box and Q&A here. So thank you for addressing that. On the topic of federal legislation, Senator Fraught, you mentioned this earlier, and Representative Senn, you just mentioned it now. One of the questions in the chat box is asking if you are in touch with our congressional delegation regarding possible legislation and the possibility of that containing federal aid packages for states. So could you address that question around what kind of communication or coordination you might have with our congressional folks?
Yeah, the answer is yes. We generally do it at a caucus or a budget level, but I'd say I know our leadership and our leadership staff is in touch with Senator Murray, who is in a lead position in the U.S. Senate on the Human Services Committee and Healthcare Committee, I believe, and as well as our congressional delegation. So the answer is yes. We are in touch with them, and frankly, the HEROES Act. I don't have the numbers in front of me, but the HEROES Act, which was a $3 trillion plan that the House passed about 2 months ago, the U.S. House passed, would have provided a whole lot of assistance to state and local governments. And what was ironic was, I think at the time that bill was passed, we didn't really see this second wave, some might call it the end of the first wave, whatever you want to call it, around the country. And actually, cases were sort of on the decline here in Washington State and in some other states. So that was back in late May and early June. And now we've seen the virus resurge. So you've got states all around the country, including from some very conservative states, that are having major costs. And I think that the reports are they are far apart in their negotiations between the U.S. House and the U.S. Senate right now. But the fact is they're negotiating, and I think Tana and I can attest that even sometimes when it's far, far apart, it looks like that on the outside, that sometimes things are more, might be closer than you might realize on the inside when people are still posturing to try to get what they want in the deal. So I think there is going to be a package. I do believe that will happen. I don't think it'll be $3 trillion like the House wants. I think the Senate wants certain things with respect to liability protection. That's the key point that they keep making. And I will say that Speaker Pelosi has been very, very public in her need to support state and local governments specifically. And I've been very appreciative of that. She made a great point, which is if state and local governments have layoffs from the service providers that they fund, or employees that they fund, if they're actual state employees, those people go right onto the unemployment rolls, and we end up paying for them anyway through additional unemployment benefits. So you're not helping your unemployment situation. at all by simply ignoring the needs of state and local governments. And I think that's a very, very, very valid point. So hopefully they'll keep pushing on that, and we'll see it going. But to answer your question directly, we are in touch, and I know that our delegation is working hard on this.
Yeah, same in the House. We try to focus our letters as a caucus, so that we're not all throwing individual things out to our congressional leaders. Having said that, I am in fairly regular contact with Senator Murray and Senator Cantwell's office about childcare. They've been very interested and engaged, and we have at least monthly conversations about that. And I think another area that has been completely not touched on and funded is Tanf, temporary assistance for needy families, and that is not something that the feds have talked about much, and so that's unfortunate in terms of helping some of our struggling families as well on the lower economic side. But definitely I agree with Senator Frockt. I do anticipate a package coming at some point. Both, it's an election year, everybody wants to look good and give out benefits, but it's critical. I mean, our states and cities are struggling, and if we don't support them and support our people, why have a government? So, I often say, and I hope other people haven't heard me say this before, but my also hope is that the silver lining of this COVID situation, if there can be one, is that it is truly my hope that people become more empathetic. And, as middle-class families and upper-class families struggle and need unemployment or need other care and assistance during this pandemic, I'm hoping that there's a little bit more empathy and understanding for families and individuals who have their own personal pandemics all the time. So you don't need to have a global pandemic to be suffering, to need extra help from our government for unemployment, for food stamps, for other programs, but rather you might lose a job, you might have a death in the family, you might have a mental health crisis, or you might just have, a family with disabilities and you're caring for your loved ones. So again, my hope is that the silver lining of this is that we generate a community that's a little bit more empathetic. And so when we are trying to increase services around human services and help for families, that there's a little bit more understanding of the pain and the need to help people when they need that help. So I haven't seen that yet, but I sure am hoping that is the silver lining.
Thank you both very much for your responses. And there have been some great links being shared in the chat box for those who may be interested in tracking those House and Senate bills as they progress. So we have about 10 minutes left for questions, and I want to get to a couple of others that have come up in the chat box, and hopefully also have time to call on the folks who have their hands virtually raised who may not be able to type in the chat box. So first, a question that relates to our state institutions, otherwise called residential habilitation centers. As you both probably know, the vast majority of people with developmental disabilities prefer to live in community settings in their own homes or apartments. And we've seen a really dramatic shift over the years away from congregate institutional settings like RHCs into community-based settings. And so there's a question here that sort of gets to how some of the proposed cuts seem to disproportionately impact those community-based settings that most people prefer. And so just, I guess, maybe your thoughts or reactions on how potential cuts may affect both RHCs and community-based settings.
Well, I'll just respond, and I think I can respond quickly. I think we should absolutely not cut back on community-based services, both in behavioral health and developmental disability services. That is a transition that we have tried to make. That is the policy of the state at this point, to try to start to move us more in that direction. And we had started to make some progress, as I mentioned, and I think we should not go back. So I do not favor cutting services for community-based supports. And I think there was a note here, Stacy mentioned we should ask for some additional help from the feds on a community waivers, that kind of thing, for services waivers. I'm not sure exactly what that entails, but we'll look into that and can certainly advocate for that. So that's my general take.
Yeah, and I would say, you know, I think there's this really interesting intersection, and I'm wondering, Senator Frockt, actually hate to pose you a question, but maybe you can talk about this a little bit too, is that there, you know, there's conversations even in like the juvenile justice space where we want to get more kids into community-based settings and out of juvenile rehabilitation institutions. But the irony is we have to spend capital dollars to save operating dollars. So we have to spend that capital dollar so that we can move kids to community settings to save on the operational side. And that's kind of a similar model with DD. If we move residents out of RHCs, we have to make sure that there's the community settings, which actually costs money on the capital side initially to move people so that you get the operational savings. And so there's this irony of, to save money, we need to spend money. And yet part of the problem is right now we don't have money to spend. And so I think there's like this, again, this kind of challenge of, there are certain things that make a lot of sense and especially longer term, but when you have to spend money that we don't have, even though that's going to drastically save money, we're kind of in a catch-20.
Thank you both. There are a couple of folks that have had their hands virtually raised, and so I want to make sure that we give them the opportunity.
Sure.
Well, actually, I'm sorry, Senator Frockt.
Oh no, that's okay. I agree. I think Tana makes a great point, and just that we have paid for some community-based capital improvements. That's been part of the capital budget. We need to do more. There is some talk about accelerating capital budget deployment in the coming year, both for economic stimulus, but also to address some of these service issues. So that's something we're going to look at. But we might be able to even pull forward some. The administration is thinking about proposing a pretty dramatic increase in our bonding capacity in the next year for those reasons, more so than we would normally do in the ordinary course, and that's something we'll be considering. So that would give us the opportunity perhaps to invest in these areas.
Thank you very much. Melinda Burgett, I think I have your name right. You had previously had your hand raised. If you still have a question, if you can raise your hand again, we can unmute you. And if not, well, it looks like you're maybe unmuted now. So if you have a question, you can go ahead and ask it. And Melinda, if not, Kim Arthur also had your hand raised. Melinda, it looks like you're unmuted now. Go ahead and ask your question.
Yeah, I actually didn't have a question. That was a error on my end. I accidentally pushed the button. So my apologies on that. Sorry.
No problem at all. We're all learning together on these platforms. Kim, you have your hand raised. Do you have a question?
Yes, we just wanted to say hello and thank you. I'm here with my daughters, Millie and Lola, and they're 7. And so we're at the very early end of learning and growing and trying to rally. And, you know, we hope to see our girls grow up to be like Devin someday. And that takes a lot of effort and work and support. And I happen to know Devin's mom, Sue. And I just wanted to thank you for acknowledging with your comments how much support we need and how much that can help to get to a place where older children are able to really thrive and flourish. And that's Lola in the background, and Millie has her shimmer doll and is waving to you right now as well. So thank you very much.
Thank you.
Okay.
Thank you very much to you all. We wish we had time to get to all of these really fantastic questions that have come in. There's certainly issues that we'll continue to address and talk about in other ways. But in interest of time, I'm going to hand it back over to Stacy to close us out with one more question for the legislators before we switch gears for the rest of today. Go ahead, Stacy.
Thank you again. And we'll wrap this up with a final question. We have had several Republican leaders in budget committees on this program over the last 5 weeks. And they have said they really want to work together. They want to make this bipartisan. They're committed to people with developmental disabilities. They always end with this interesting note that the Democrats are in charge, and we do look to you for some leadership. And we're curious from both of you, what are your thoughts about reaching across the aisle to work together, and what leadership can you provide to get us there so that this is a bipartisan effort?
I'm happy to go first since
Yeah,
David's
please. Yeah.
So, you know, I was on a panel with Representative Schmick, who's focused on, you know, in the healthcare arena, and he's very supportive of DD services and mental health. And we were, you know, somebody brought something up about revenue, and he said, oh, we don't need additional revenue, we just need to prioritize. And so I challenged him. I said, you know, I think that's a great point. Okay, so where would you take money away from? And he said, well, we don't need to take money away from anything. We just need to reprioritize. I said, okay, totally. So if we're going to add more money, for instance, to mental health, where should we take that from? He's like, no. I don't want to take away money from anything. There's a lot of areas that still need that money. We should just reprioritize and spend more money in these areas. I was like, okay, well, if we're not adding revenue and we're reprioritizing, help me understand, where would we take money from? If we're going to increase one, we got to decrease another if we don't add revenue. And honestly, we went back and forth for like 5 minutes, and he refused to, or was unable, I don't want to say refused, unable to share with me any areas where he would cut and to reprioritize and add money to areas like mental health and DD and other places that were priorities. And you know, to be honest, that is where I experience frustration sometimes working with the Republicans is it's very soundbite to say we have enough money, or soundbite to say we should put more money in DD or in areas where people have a lot of personal passion and you know, mental health and things like that. But without additional revenue, we are taking money away from areas. And you know, whether we're talking about K-12 schools that just got a huge bump, they still don't have school counselors. They still don't have, you know, that key support, in my mind, nurses. They don't have that. So we just added millions and billions to K-12, but we still don't have nurses and school counselors. 1% of our budget is on childcare, which is absolutely critical, and we don't fund that. We don't fund enough mental health services. Our caregivers and supportive living and, you know, aging and long-term care in any of these DD services, childcare providers don't have health care, like all these things that are so underfunded. Primary care physicians, you know, the percentage of Medicaid reimbursement doesn't even vaguely cover the actual costs. So there's all these areas that even as we pre-COVID, as we inch along, are dramatically underfunded and, you know, are at a tipping point. And now here we are at this point where we've tipped. And I just don't, you know, with less revenue coming in, I just don't see how we can not add revenue. And I certainly hope that people recognize, you know, Republicans recognize that they can't, and they will, they'll blame us for all the cuts. But again, it's easier to be the just say no, or to be the, you know, the parrot when you're not in control, that we will have to make cuts because we are already at this tipping point with the revenue we had. Now we have less revenue. And so it's really going to be a challenge, and it's going to be painful, but, you know, and I don't anticipate there being a lot of collaboration because frankly, the Republicans, and if we were in the minority, we would do the same thing, want us to look bad because we will be in the majority and making painful cuts, but that is where we'll be. And so hopefully, if anything I can say is that I hope people will support new revenue. And so we can make any cuts as or either not, you know, maintain that level of service without having to go down. But, you know, again, I just really want people to understand there's a reality of that you have to balance.
I would say that on the policy side, I think there is the prospect of certainly I don't know the dynamic in the House right now, but certainly in the Senate, we have had, and I've certainly tried to help in this. We've had pretty good bipartisan cooperation on disability services. In particular, Senator Braun last year, as I think many of you know, helped push through the James Thompson Trust Bill, and the funding of that was something that we worked on collaboratively with him in the budget, even though I don't think he voted for the budget in the end, but certainly that part of the budget he was supportive of, and I was supportive of that. We were able to get some money in there. He also, we had a bill that John was the lead on, and that came through the Healthcare Committee to provide more acute services for those who ended up being in hospitals, hospitalized and so forth, from the disability community, developmental disability community. And that was also a good bill. And then also, as I mentioned, he's been very, he and Senator Kaiser have been strong leaders on the Ruckelshaus process as a bipartisan team. So that's really good. That said, I do concur with Representative Senn that when the rubber meets the road, I am not anticipating great cooperation on budgeting. I think that there is going to be an article of faith that the other side will not agree to any kind of revenue. I could be wrong. Maybe there are certain things they could agree to. I could certainly agree to certain things that they would propose to, for example, help with our manufacturing base, to provide more tax incentives and those kinds of things if they were done in certain ways. I think those are areas that we could have cooperation, but I'm not anticipating that they'll be willing to do that. Maybe I'll be wrong on that. Maybe they'll surprise me, but I'm just not anticipating that. So it's going to be a challenging session, and but we'll try to work together on policy, and maybe there's a deal to be had on revenue, but I'm not real. I think it's mostly going to be a Democratic conversation, candidly.
Yeah, and again, I think just following up, Senator Braun also, I think it was his bill to do caseload forecasting for
right.
DD, and that was, a really important bill. And I had a similar one just to do DD, kids in foster care with DD, to track that. And so glad that we got Senator Braun's bill. And I advocated. It was dead in the House. It wasn't going anywhere. I advocated really hard. Adrian Stewart was amazing, bringing us together with the Senate leadership for a meeting, and that unleashed it, and we got it passed. And that on the policy side, I mean, working together is critical, and it's actually it's beautiful. Like, we get along really well. I mean, interpersonally, there's a lot of collaboration. There's a lot of work. I mean, there's very few people that I, on the Republican side that I don't work with or can't work with. And we, on great policy, it's people have that in common. It's then how do you pay for it? And that's the third rail. And so on the policy side, there's a lot of great collaboration, and this issue is very bipartisan, and many issues are. It really comes down to like as David said, Senator O'Ban didn't vote for the budget. So here's all these things I want in the budget, but I'm not going to vote for the budget. And so it just comes down to that. And that's just how it goes.
Thank you, Senator Frockt and Representative Senn. Those comments are wonderful to hear, good to hear, very hard to hear as well on some level. And one of the things I think we try to say is in our community, as you noted, at best, we have about 120,000 people with developmental disabilities in our state. Even if you only served who you're already serving, you're serving about 50,000 people. That's a very doable number, because compared to 1 million school children or the numbers of people who need childcare. We are a steadfast group. People with developmental disabilities aren't going anywhere. We have a predictable number of people who would be born every year with developmental disabilities. We know what the needs in our community is and are. As you mentioned, Representative Senn, caseload forecasting is also critical for the state to understand how many people are we, what do we need, and what does that look like? And what we would ask of you in our closing is just as you bring those 5 or 6 priority groups with you into the caucus and the negotiating room, that this very small, mighty group of people who have developmental disabilities, who contribute to our society, and should be ranked very importantly in the group of vulnerable people, will be on your short list. So thank you again for listening to us today. We're going to turn it over now to the rest of the community who have been listening to you here today, so they can learn some advocacy tips. They can learn how to kind of be in those rooms with you through their own legislators, and hopefully we can keep this conversation going. Again, we appreciate all your time here today. So Diana, you want to take it away?
Thank you very much. Thanks for having me.
Well, we really appreciate having both Senator Frockt and Representative Senn with us today. There have been some very challenging conversations, but they've given us an idea of some of the things that they think they might be able to do. And now it's time to let you know what you could be doing to help as well. So we're going to go through a few of these things. One of them is being part of the Action Center for the ARC. And you can go to our Action Center page on our website, arcwa.org, and you can sign up so that you can get email alerts or text alerts whenever there's something that needs to be acted on. Currently, now you heard from both of the legislators about the federal government and hoping for aid from them. There is a call to action on our Action Center that is specifically for those federal issues. The HEROES Act is what the House passed. And then when it came to the Senate Republicans kind of put a number of bills together and called it the HEALS Act. But it doesn't include a lot of what we need, especially the funding for Medicaid waivers. That's one of the big pieces that our state needs some help with. We also have state alerts about the cuts that are being proposed and letting legislators know that those would cause crisis in families. I'm going to turn it over to Emily Rogers for a moment and let her talk about the DDC Advocacy Toolkit.
Hello. The DD Council has a toolkit that's available to you that has quite a number of things that you can do and ways that you can get your voice heard. So in the first column, we talk about social media and different hashtags that you can use when you use social media. So things like cuts cause crisis and vote DD, and there's videos in that column. One from Bill and Karina, which are longtime friends of mine. It's an excellent video that you can use and attach to some of your social media. And there's images and examples of Facebook posts. In the middle of the document is messaging. And the thing I wanted to say here is that you want to speak really plainly, because lots of times when we speak, because we're familiar with all the jargon and everything, we start to speak in a way that not everyone understands. So you really want to make sure that you are speaking in a way that makes sense to everyone and that avoids all the letters and jargon, so that you can make sure that your message is really clear. And when you're thinking about where you might want to get your message out, you want to think about things like community meetings, social media, the different platforms that we're on now for our meetings, and talk with your friends and family, neighbors, and others, your legislators, of course. At the bottom of that column, there's some supporting documents, some letters that'll give you some good facts and information that'll be good for your advocacy efforts. And then in the final column, there's some examples of emails and some words that you can use to put into your emails to make sure that your messages are really clear and concise. And also some phone call script if phone is the best way for you to reach out. So this document gives you many different ways of advocating, and it's a really good resource for your advocacy efforts. Thanks so much. Have a great day.
So now we're going to have Jessica share some tips.
Be sure you know which district you live in. You can find it by going to the legislative website shown and putting your address in the form. To email your legislator, it is the same format for them all. You just need to know their first and last name, which you can also find on the legislative website.
Thank you, Jessica. So we've given you quite a few ideas here of things that you could be doing, and you can do a lot on social media. There's a lot of people are on Facebook or Twitter, posting on YouTube. So there's also groups that you can join, so you can get more information. Like if you're a parent, you may want to join the Parent Coalition in your area, or self-advocates have self-advocates in leadership. And all of these different things are happening virtually right now, because in this day and age, we just don't get together in groups anymore. But now I'd like to know, what would you like to do? Think about, I'm going to put a poll up here, and I want you to think about, over the next week or so, what can you do to make your voice heard on these issues that you've heard about today? So I'm going to launch this poll, and you could respond to one of the action alerts on our site. There's also a petition on the site. You could use the Dda Advocacy Toolkit, or call or email your legislator. And of course, getting on social media, you share it with your legislators that way, as well as your friends and family. And you can get together with others, either in an advocacy group that's already formed, or maybe you want to form your own little group, and keep everybody posted on things that they could be doing to make a difference. And as you heard from both legislators, Senator Frockt and Representative Senn, right now there's really a need to hear from the federal government, for your senators to hear from you, to say the bill that passed the House had the things we need in it. Help for the state on our Medicaid waivers so we don't have to have those cut. Not making the proposed cuts here in our state to DD services. And you have a voice in that. You can make your voice heard so that you can help get these problems with the budget at least a little bit better than they are looking right now. So it's very important that you use your voice. So it looks like everybody has done polling. So let's see what we have here. Lots of people are going to go to the Action Center and get involved in the action alerts. That's a good thing. And signing the petition, calling or emailing your legislator, and on social media. Those three things took 46% of this. And the Dda Advocacy Toolkit and getting involved in other groups is really important too. We want to thank you all for coming to this. I know we had some technical difficulties, but when we post on the website this video from today, we will also post Devin's video so that you can watch and hear that. And then we will also make sure that we have closed captioning on today's recording when we post it. So thank you all for joining us. Next week is our last virtual advocacy day for right now. So I hope you will join us next Thursday at 10 o'clock. Thank you, everybody.